Okay, thanks everybody for joining us this morning. I might make a start, but before we do, I would just like to acknowledge the Aboriginal and Torres Strait Islander peoples as the first Australians and traditional custodians of the various lands that we're all coming together from today. In my case, I'm joining from the lands of the Awabakal people here in beautiful Lake Macquarie in New South Wales. I would also like to pay my respects to elders past and present and extend that respect to other Aboriginal and Torres Strait Islanders who may be joining us. So thanks everyone. I'm really thrilled to be introducing Associate Professor Hayley Christian to you all for this special presentation where we'll be hearing about the play spaces and environments for children's physical activity, health and development research program. So Hayley is a National Heart Foundation Future Fellow, and she also heads up the Child Physical Activity, Health and Development team at the WA Telethon Kids Institute. She's also an Associate Professor at the School of Population and Global Health at the University of Western Australia. So broadly, Hayley's research is focused on identifying the best environments, policies and programs to support physically active lifestyles. So obviously this is an area of great interest to many of us, so we're really thankful to Hayley for sharing her knowledge and insights with us today. So we will have time for questions after the presentation, so feel free to put any questions into the chat as we go along if, as they come up. So that's all from me. So at this point, I'm thrilled to hand over to Hayley to start her presentation.
Thanks a lot, Meg. Hi everyone, just give me a moment while I share my screen. Presentation. There we go. Is that good for everyone? Looking normal? Great. Thank you. So I'd also like to begin by acknowledging the First Nations people's lands of which we meet today and to pay my respects to elders past, present and emerging. Thank you very much for having me. It's so nice, even though we're online today, it's so nice to be in person and see people 3D and see lots of people already that I've really just kind of seen from the shoulders up over the last couple of years. So this is quite exciting, thing to do again, see people for real. So let me run you through our PLAYCE program of research. It's kind of a little bit of a history lesson, hopefully a bit of insight to the pathway of how our program has developed and where it's at currently and where it's heading. And opportunities, of course, for questions and answers at the end and collaboration. That's really the purpose of my visit today. And you'll see there's plenty of data that we'd love to collaborate with people on as well. So I'm going to begin by acknowledging there's a lot of people involved in this research, a lot of amazing investigators, staff and students, and of course our incredible support that we get from our various funding bodies to allow us to do the research that we do. So broadly, our research is around finding the best environments, policies and programs to improve children's physical activity levels, health and development, to set them up for lifelong health and wellbeing. And our focus predominantly, not all the time, but mostly is that first 5 years of life, really supporting and finding those strategies and interventions and, policy levers to enable children to have establish healthy behaviours early in life that can track through childhood and into later life. I'm going to just do a few scene setting slides. You can kind of go to sleep now if you're all over this. I'm sure you are, but it's just kind of good to set the scene and where we kind of place our research. So I'm sure you're all aware of our national report card in terms of physical activity. This is the 18 report card. 22 ones the same, barely passing with a D- for children's overall physical activity levels. Our own PLAYCE data has contributed to both the 18 and the 22 report. But really, when you look at the report card across all the different, I suppose, domains that are assessed and given a grade, it's that one in the middle. I can use my mouse here. Active play. Still, after all these report cards, I think we're up to our fourth or our fifth. The evidence we have around the early years and physical activity or active play is inconclusive. So we still need some stronger, surveillance data just to understand what's going on here, so then we know what to do, what needs to be done. All right, again, just a reminder, particularly for the early years, no matter, whether it's school-age children or adults, there's a whole host. All of those benefits of physical activity are there from day one in the early years. And in fact, I'd highlight the early years being such a critical period for a child's development, that those developmental benefits that come from physical activity are even more important. Again, we talk about physical activity in general, but really it's the active play when we focus on the early years. So the play is vital for all domains of a child's development. And if we want, the silver bullet, it's the outdoor play. It's really the time spent outdoors that facilitates more activity, that facilitates the different types of play that contributes to a child's development, and of course prevents many of our NCDs as well. So this is where it began. We've kept the name as the research program, but it did just begin as a large cross-sectional observational study called PLAYCE, or Play Spaces and Environments for Children's Physical Activity. Large 3-year funding from Healthway back in 2015. So this is kind of the flagship, the kick-off project that got us moving in this space. 3 broad aims. We had no data, nothing on physical activity levels in the early years in Western Australia. We'd had a physical activity task force led by the government health for a while, but that had dissolved, and no data at all had ever been collected on that first 5 years. So how active or inactive were young children in Western Australia? There was a real focus on the childcare centre environment. We had, again, nothing had really been done in this space. And of course, if there are issues, what strategies, what are some of the ideas that we can pilot to improve things if needed? I might say, in going back there, sorry, is that, I know what you guys do here and it's amazing and how your system works here, but I'm going to have to say that, we were still far behind what was happening in places such as here in terms of even just understanding activity levels, let alone interventions targeted at that age group. All right, so the original PLAYCE baseline study, large cross-sectional observational study, just under 100 childcare centres in the Perth metropolitan area, just under 1,600 2 to 5-year-olds. 3-year study, rolling recruitment data collection. We nested some pilot interventions in there as well. So in the end, we had over 120 childcare centres, which is about a quarter of all services in the Perth metro area, and just over 2,000 children with at least accelerometer data. Once we had those nested interventions data included as well. 7-day accelerometry, we've actually now followed up these children. I'll talk about this in a moment in the cohort study. And so after this original time point, we moved to 24/7 monitoring. So we captured sleep to align with 24-hour movement guidelines. So objective, comprehensive measure of physical activity during childcare, but over the 7-day period as well. Really wanted to capture children's physical activity in terms of their spatial location, so a subset of around 400 more GPS devices. Now, GPSs are great when you're outside, not such great signals when you move in, so we then complemented this with some tech that's been used for years in the hospital setting to monitor patients as they move between different tests and levels and so forth, called radio frequency identification. It was a proof of concept. It had a lot of challenges. I can do a whole other presentation and conversations on the side on this if you're interested. Chat with me, but that data set has had its challenges. It's sitting there, so if anyone's really interested in this kind of data, I'm very happy to chat about what we can do with it. But we have it for, I think we had it for about 60 to 70% of the sample. A lot of information there to look at. I've got a PhD student at the moment, Paul Anbai, who's taken that subset of GPS, accelerometry, and then overlaid it with geographic information system to understand at a real kind of micro-built environment or physical environment level, the childcare outdoor space, how children are interacting with those spaces, the features of them. And what you can see on the left there is what's called a hotspot analysis. So all those really red dots are where children are being super active, and we're talking about moderate to vigorous physical activity, and those blue spots, the cold spots, are where they're being inactive. And what Pauline's been able to do is identify what are the features of those areas. So the OAs are outdoor open areas. Obviously, open areas encourage children to run and play and be more active. But what she's found in this paper, it's actually the first one from her PhD, was it's not just the number of outdoor areas, but how these different types of areas connected up as well. The paper's there if you're interested and you want to have a look at it. Of course, the PLAYCE study had a very comprehensive parent survey. You name it, we tried to measure it. We had pretty good response across all of the survey items, but I just don't feel in today's climate we'd ever be able to ask that many questions. But anyway, it's a very rich data set. And they're a great cohort. So we have, for the most part, been able to continue these measures through for another 2 time points. Comprehensive measure of the physical environment. We adapted existing instruments, EPAO and knapsack and others from the childcare setting for at least the West Australian setting. There's a reliability methods paper there. We also collected data on the physical environment. So we wanted to understand the actual space or amount through geographic information systems of outdoor area, accessible space. We looked at vegetation within childcare and looked at those green spaces, traffic exposure in and around services as well. Comprehensive audit of the policies, which I'll come back to, which led to our next project, and measuring educators' practices as they relate to physical activity in sedentary screen time. So, bombed you with a whole lot of data there. This is probably the summary of it. If you look along the side there, kind of typical social ecological framework of all the different levels of data that we've collected. At that childcare setting, at the home and neighbourhood. And as I mentioned, with further funding from Healthway now and the NHMRC, we've been able to follow up these kids 2 more times. So the second time point is as they've moved into their first year of primary school, so that 5 to 6 age group. And then we're just finishing up a third time point when they're year 3, 4, that kind of 8 to 9 age group. So some good longitudinal data moving through and being able to adapt with, changes in guidelines and policies as we go along as well. But kept that core data moving through. So that first study, PLAYCE, and what we call now baseline in terms of the cohort study. A lot of this data was not really publishable. The field had moved on, but it was really important and relevant for WA. So we released the key findings at a high level through a report. And let me just take you through them again. Nothing kind of new to what you guys already know. Using accelerometry cut point methods, and again, that's another presentation and conversation we could have. But using traditional cut points with the accelerometer data, only about a third of these 2 to 5 age group were meeting recommended 180 minutes of activity per day. If you throw in our 24-hour movement guidelines, which came in a little bit later, overall across the 3 movement behaviours, physical activity, screen and sleep, only 7% were meeting all 3. Doing well in terms of meeting sleep guidelines. I think as a parent, you're so obsessed with it from the day they're born that you just, I don't know, you're a bit more focused on it. But falling well short in terms of meeting both physical activity and screen guidelines in this very young age group. But as I said, it was physical activity here was determined through accelerometry, but sleep and screen were parent reported from the survey. Now, as you guys all know, we apply the same 24-hour movement guidelines, physical activity guidelines that are available nationally for a typical day to childcare, even though there is the time before and after childcare that children can have to accumulate more activity. But if you apply those same guidelines based on a standard 8-hour day in childcare, only 12% in our sample were meeting guidelines. So it really dropped off. And in case you weren't aware, you can already see that sex difference at a very young age. Look at it, 3 times as many boys. I can't believe I'm still trying to get my head around the data and why that's so predominant at such an early age. Anyway, we collected lots of data around the physical environment as well, and I'll just give you a little bit of a taster for this. Interesting, when we looked at natural features and green spaces, on average it seemed like services had lots of kind of access to natural elements, moving away from kind of the plastic fantastic and the fake grass. But really, when we got down to actually measuring the details, the majority still had artificial grass, and it was really a lack of different vegetation types. And this was the audit tool. This is the observation tool. we've taken that to the next level and kind of building on my skills and experience in built environment health research. And what we've started to look at that kind of, again, micro childcare outdoor space and also the home environment is actually look at the amount of vegetation and the level, height of that vegetation. And obviously tree canopy is really important for shade protection, for shade and, allowing more opportunities in our, warmer months, particularly for places like Perth, for kids to be outdoors and active. And that polygon or that shape there is an outdoor childcare centre. And the little legend there shows you that is in one of our leafy green suburbs. Obviously, this service has got a lot of vegetation and the majority of it is 15 metres plus, so lots of good tree canopy and shade at this service. But that is not the case in a lot of our services in our outer suburbs and in new developments. They're pretty hot, and you throw in, their location sitting on major roads and traffic exposure and air pollution, adds a whole lot of other levels. So some of that earlier work, that first paper there showed us that more vegetation in childcare centres was associated with less UV exposure to children attending that centre, and also more time spent outdoors. And the bottom paper there, if you're interested, this is one of the next pilot interventions that we did as part of the original PLAYCE study. We took the opportunity because we were collecting data over such a long period of time. A lot of services are letting us know you can't come in now. We're upgrading the outdoor space. It's not looking very good. Don't come out and visit us. So we kind of turned that into an opportunity and got a little pot of funding to conduct a natural experiment and get in before these services upgraded their outdoor play spaces to understand the impact after the novelty effect of a new playground wore off, to look at the impact on children's physical activity. And generally, there was a trend for these upgrades depending on what they were. But generally when there was more, physical activity promoting attributes going into these upgrades, we saw a small increase in activity. As I mentioned, really interested in that home yard space as well, and this is where we're going with some of our more recent work. This is an MD research student project. It was just parent report data on the amount of outdoor play children were doing at home, but definitely showing that, the size of the yard, the amount and types of different play equipment, and again, coming back to having those natural features. We work closely with a lot of government departments, particularly, obviously health, and when we do the environment work, it's transport and planning, and we've been having some really kind of difficult, but you have to, challenging conversations, because the research would say that we need more outdoor home space to support kids' activity, particularly in the early years, but we can't keep going with urban sprawl, and so there's a pressure to increase residential density, and it's a really challenging conversation and way to work through, but it's great to be partnering and having those conversations rather than ignoring them and kind of just, leaving the issue there and not doing anything about it. So, as I mentioned, we now have the opportunity, or have had the opportunity to follow this cohort of about 2,000 2 to 5-year-olds through to primary school and now again kind of year 3, 4. And this has been funding through what we call the Beaches project. It was a UK Research Institute and NHMRC collaborative call for research, so it required an Australian team and a UK team to partner up, so very big team, very big beast to kind of run. They funded 5 projects. The focus was all around the role of, higher quality, longitudinal, better evidence around the built environment and its role in preventing or, supporting, I suppose, NCDs. 5 projects were funded. We're the only one that really focuses on the early years and children. The rest are in, adults and older adults. And so because we were focusing on children, we weren't really looking at NCDs as an outcome, but we're looking at those modifiable risk factors. I didn't think of the acronym. The Wales team did. They thought it was great, even though I told them we have way better beaches in Australia than Wales. Anyway, continue to have a little discussion about that. So these are the Australian partners, very collaborative across all our different state government departments. You'll see in a moment the cohorts that we're involving, very WA heavy, so hence our partners are mostly WA based, but a good mix of NGOs. We've got some of our early years partners thrown in there, and we've got actually some of the planners, and have worked closely with the Planning Institute of Australia around some of this early work as well. So Beaches has 4 work packages: a policy review, what we call data harmonisation. We can't change our cohorts, right? That's existing data that we've got, can't do much about it. We can clean it and recode it, whatever. But it's really about harmonising those built environment measures across the 2 sites. You know, big epi piece to analyse it all, and then that impact piece, which we chuck at the end as work package 4. But really, with our partners, it's a continuous process that they've been involved, you know, obviously even in the writing of the original grant application. So as I mentioned, 3 big cohorts that we're working with for Beaches: the Origins project, which is a relatively new, maybe not so new now, birth cohort study running out of our Joondalup Health campus, which is in the northern suburbs of Perth. Our own PLAYCE cohort study is contributing, and so I should say Origins captures that kind of 0 to 3 age group. PLAYCE is picking up on the kind of 2 through to 10-ish. And then we've got access, just got approval from ACE for linkage and access to the longitude study of Australian children, and that's capturing those kind of adolescent years in terms of, you know, what we're doing with the project. And the LSAC data, we've really just focused on more the vegetation measures and the whole suite of built environment features we've not looked at. All right, the best I can do is give you some results from the work package 1, because we're deep in the work package 3 EPI analysis. Oh my goodness, there's been so many decisions to make with those data sets, and how we analyse, and what would be important for a 3-year-old versus a 10-year-old versus a 15-year-old. There's been some really big kind of methodological decisions that we've had to make. Anyway, we think we'll have some good methods papers to come out of it. But I can present and give you the results from our work package 1, which is a review of all West Australian and relevant national policies as they related to the built environment and its influence on those key modifiable risk factors to NCDs and children. We released the report in Feb, my goodness, only Feb this year. It's like ages ago. It's on our website. I can share it around. But it is a review. It is a report, and it's about policy. So it's quite long. So let's just go straight to the infographic. We had several key findings come out of the review. The number one that I think really took our attention and has resonated with our partners across different government departments is that there was just no mention of children in any of these policies. So it didn't matter which government department and which policy it was. There's just no mention of children or families. So we really, in the Telethon Kids Institute and the work we do, really valuable to have consumer and community participation in our research. Partner stakeholders, government, industry, very important as well. You need to have your parents and your community there at the table from the beginning and right through the research process. So, our first recommendation is that we need to hear the voices and we need to see more community participation in the development of new policies as they relate to the built environment and child health, but the review of existing policies as well. And some of you guys would have the same, I'm sure, that we have commissioners for children and health people in our states and nationally, and I think definitely know in WA there's some good work that's been done to advocate for this as well. Again, infographics on the website. I'm not going to go through these, but several other kind of key recommendations that probably you'd expect, but maybe given who you are and what you guys do here as part of the centre, we did call for also a more rigorous and transparent process of policy implementation and evaluation, and making sure that there was use of targets and better measurement tools. So yeah, quite often there was some mention of evaluation, or there was going to be an evaluation, but there was never kind of that follow-up. And I don't know, things like change of government definitely throw a spanner in the works, but that was a big relevant call from the review as well. All right, let me take you now to kind of 3 flagship projects: the PLAYCE cohort study that kind of now has fallen under the Beaches project, but taking more of a built environment angle, to really the work that's developed in that childcare setting, and this is the Play Active program. So this is a NH&MRC partnership project. You can see there our formal partners on the partnership grant. There's a whole host of other informal partners as well that are very engaged in the process. But let me kind of just take you through, you know, how we got there and what it's about, and I'll just give you a quick sniff of some early findings as well. So you'll know, because lots of you have probably been involved with the Cochrane reviews and things like that, but in terms of, you know, where to intervene, I think it was really obvious in our PLAYCE baseline study that there was very little mention. There was a lack of comprehensive physical activity policy, but even just little mention of physical activity in any policies in the childcare services, definitely in Perth Metro. And you can see the differences in areas such as here. That really kind of shocked a lot of our EC providers in Perth. They kind of felt they ticked the health box quite well and just didn't realise that, and weren't even aware of things like physical activity guidelines. So there's been a whole awareness raising process. Now this is kind of hard to understand because we have national quality standards, right? And there's one there that sits under health and safety, which is about promoting and supporting children's health and physical activity. So I think in engaging with the sector and providers and even, you know, talking and working with the CEQA, the regulatory body, there seems to be here's the standard, but where's the supporting resources and training to, you know, ensure services can, you know, not just meet but exceed in this quality area. So I think these are some of the things that we were trying to understand and work up with our partners and really kind of put into the Play Active program. So in essence, Play Active is an evidence-informed physical activity policy template. It's boring, it looks horrible because it's a template, right? It's evidence-informed. We did a whole host of like half a dozen or more focus groups with the sector. We did a large national Delphi survey. So we feel like it's robust, it's evidence-informed. It provides childcare-specific guidelines on how much activity children should do, you know, standard kind of 8 to 10 hour day. And similarly for screen time and sedentary time, and a whole host of, I suppose, you know, practices across different domains that educators and services should work towards. So it's a template because we want services to take it on, brand it and make it their own. They just can't change some of the things, some of the important things like how much physical activity children should do each day, but they can adjust it and make it their own and incorporate it into their existing policies as well. As I mentioned, there's a number of policy implementation strategies, comes with an evidence-based resource guide. We've adapted the outdoor play assessment tool and now it's an energetic play assessment tool. Takes less than 30 seconds for educators to kind of benchmark and see where children in their care are at, and then, you know, as they implement the policy and the different strategies, they can use it again. Really quick and easy. Real lack, not here where I'm sitting where you guys were, but everywhere else pretty much in Australia, complete lack of any PD or training specific to promoting physical activity in young children in care. So that was a key piece, and we've done some pilot work to work up some programs, which I'll talk about in a moment. And then a review and accreditation process, lining all of this up with national quality standards as well. And there was some minimal project officer support. You will not be surprised that was the most expensive and is the most expensive component of it. And it was pretty minimal. So part of the work moving forward is to determine how we still keep that element, but yeah, make it scalable as well. So in 2021, feels like 5 years ago, it was only last year, we ran a Hippocratic cluster randomised trial. We had about 80 services take part, several hundred educators and 1,000 kids in the end across those 80 services, and really it was to test this policy. We had very good advice from our sector that to roll out this intervention, again, I can talk about this another time, but to roll it out, if their guidance was try and get it done in the calendar year. It's too complicated with kids moving on and the changeover you have in staff. So what that left us with with everything else that happens before and after rolling out intervention, it's left us with about a 3-month implementation period. Very short when you're trying to implement policy and a new policy, because no services really had a physical activity policy, at least for us in WA. So it was a relatively short policy implementation period. Throw in COVID, throw in, childcare issues, work shortages in the sector and increased demand for childcare. And it was a challenging trial. We were still able to do it because our borders were closed, but there's a lot of challenges that were thrown in on top of it. The good news is, and the paper's just been submitted, so it's under review, so just for you guys, we did see some small changes, positive changes in educators' PA practices, a small improvement. Obviously, the program was feasible, acceptable, had good reach, and all the rest of it. All those boxes were ticked. But even in that 3-month implementation period, with all the other challenges thrown in thanks to COVID, we did start to see some positive changes in educators' physical activity practices. I might mention there was absolutely no intention with this trial ever to measure children's physical activity. We straight away said, look, 3 months implementation, and if you think about behaviour change, why would you expect in that period of time to see a change in kids' activities? You might start to see some changes in practices, and even before that, we might even start to see some changes in educators' confidence and motivation in providing more opportunities for activity. So that's where we're at. We're working on some of the secondary outcomes as well, but again, happy to chat, still kind of hot off the press in getting our heads around, what's coming out of the trial and what does it mean, getting input from from the sector and our other partners as well. So I mentioned before, I suppose the key thing we were hinging on in terms of the implementation strategy for Play Active was the professional development and training. And so we'd worked previously before the partnership grant with 2 of our partners who had successful PA or physical activity PD programs in the school setting, and we piloted and tested those for the early childhood education and care sector. So one of them on the left came out of UWA, it's now relabelled, rebranded as Kiddo, and the other one was with our partner called Nature Play WA, which there is also in some other states, and I think there's still a Nature Play Australia overall. And those pilots were great. They all, worked well. We could get these programs, PDs from school setting into childcare. They all were available online. I think Nature Play had a face-to-face as well, but it was luckily we, went with the online because of COVID. But what hit us hard here in terms of the implementation strategies, this one we thought, should be the key one, was that when COVID hit, staff shortages, increased demands meant what's going to go first? PD. They were really, especially when we did the post-intervention data collection, we weren't even getting directors. They were all on the floor. And, we've got one of the biggest providers part of the part of the project, and they're just going, look, I'm sorry, we're just doing the basics of care for children. Anything else at the moment is not happening. So this one's kind of really hit us hard, and we really hope that we can continue with the scale up of Play Active, that we can follow this on and, show that it does work and it is a critical implementation strategy. Anyway, all right, I've talked a lot, but here's a summary from my head, from my map, of our research program. Messy. I'm sure yours is similar. It's really kind of a mind map of how everything, where it started, how it's all connected and come together. That doesn't look good. I've simplified it in a nice linear way. So that is where we're at. So really across the left of the screen there in the green are more our physical activity-based projects. They're all interventions. They're mostly national. And then to the right in the blue, you've got more of our built environment, child health and development projects. And overarching the top, starting in 21, but again, can't believe it's nearly the second year already, we've been fortunate to be part of an ARC Centre of Excellence, known as the Life Course Centre. So let me just briefly take you through what that's about and the opportunities that it's providing to go forward. Oops. So its full name is children and families over life course, but we ensure that it's through the life course centre. 4 universities involved: UQ is the lead, Uni Melbourne, Sydney and UWA, for which Telethon Kids Institute lead that. Really, it's taken our research program, it is taking our research program, in a different approach, but a really important one, and challenging us, because what we're having to do now is overlay with all our, most of our existing programs that research going forwards is this lens of disadvantage. It's come, out as more of a social science, but being a centre of excellence, very multidisciplinary. And there was a previous life course centre that was funded. They kind of beat the odds and managed to get another lot of funding. So the first centre was about describing the problem. This centre is about doing something about it and more intervention focused. And I think this centre has also brought in new disciplines, and it's the first time they've had public health researchers involved as well. So in a nutshell, and as you can see from the figure there, it's really about trying to break that cycle of deep and persistent disadvantage, focus on children and families. This is the team. I think this slide is a little bit old. We've had a few small changes, but your top right, Janine Baxter at UQ is the director. Deb Cobb-Clark at Sydney is our deputy director. And there's 2 CIs at Telethon Kids Institute, myself and Donna Cross, but Donna has recently retired, and Frances Mitchell is now the other investigator at the TKI or UWA node. So that's the team. Good mix: economists, a couple of public health researchers, social scientists, data scientists. So quite a big mix in there of researchers. And of course, we haven't been able to meet until about a month ago, face to face. So 4 universities doing quite independent research, not great for a centre. So the opportunity to meet about a month ago was really important to start more of our what we call cross-nodal collaboration. Really briefly, 3 programs of research: places, people and opportunities. And what I thought I might just quickly do, looking at the time, is just kind of show you where our research sits within the centre. There's a lot going on. So one of our key projects is around using data from the Australian Early Development Centres. We now have 5 waves of data going back to 2009. This is a census, as it says, capturing every 98% of children's development across 5-6 domains as they enter their first year of school, and using this data to look at the role of different built environment features and its impact over time. We've done some work already in this space, but this is an opportunity to look at these relationships longitudinally and really add, I think, important indicators, and it might just be one into our already national livability indicators. Very adult focused, and we believe that this work can at least contribute, a family-friendly type livability indicator to those that already exist. Our Play Active project fits within the Life Course Centre. Kathy McLaughlin, which many of you know, is leading this work under the Life Course Centre and its scale up, and again throwing that disadvantage lens over that research. I don't think I need to say any more than that. And almost the last slide, and I better not leave this, because if anyone was onto that linear figure I showed you of our research, on the far left was a dotted box that said something about dogs and physical activity or paws. This is research that goes back to my own PhD. It's always so much fun. I got kind of known around the traps back to my PhD, maybe early postdoc, as the dog lady. Didn't like it, so tried to brush it off. And so didn't do research in this space for a little bit, but then kind of I got a bit of recognition from the work I'd done my PhD and the papers published, blah, blah, blah. Thought, oh, we'll give it another go, but we'll take the child lens. Anyway, haven't looked back. Love this part of my research still. Always gets lots of media. Can almost do it with my eyes closed. Really love it. But what we've been doing is taking, some of this work to understand how these relationships between pets and physical activity and child development begin and start. And this is a classic paper showing that, those relationships a child has with their pet, particularly the dog, really starts early in life in terms of being, facilitating physical activity, whether it's playing with a dog, family dog walks, and then we start to see also these developmental benefits as well. So really important piece of research. We did an mHealth light touch pilot intervention, which just finished last year sometime, and now we have a PhD student, Emma Adams, who's scaling that up into a larger, again, family-based mHealth intervention targeting parent and children's physical activity and mental health. So guess what it's called? Place Pause. Anyway, that's a lot of fun. Again, that's another presentation I could do if you're interested down the track. But I just thought I'd finish with that because it is a really fun part of the research we do. It is physical activity related, and now we have a PhD student on it. I don't think we'll be ending anytime soon, so we'll keep pushing ahead with it. And I think that was it. So thank you very much, everyone. I'm really happy to take any questions or comments. I haven't been looking in the chat, but yeah, thank you for having me.
Thanks so much, Hayley. That was awesome, and particularly loved your final slide as a, dog owner, and yeah, very much a dog lover, so welcome that work. So yes, everybody, please feel free to either put a question in the chat or raise your hand, or I'll do my best to monitor to see any questions that come up. But I just did have one first up, just going back to the policy template intervention, and you mentioned kind of PD being one of the key implementation strategies, but I just wondered what other strategies you might have explored as part of that intervention?
Sure. So, yeah, the PD was the key implementation strategy. We wrapped that with a resource guide, evidence-based, and really what we did is the resource guide. So the policy template has recommendations on how much activity, screen time, sedentary behaviour, and then across 4 domains, it kind of sits educator, physical domain, I'm going to miss one, children and families, and I think review and accreditation, yes. I think there's about 25 different strategies, or for the sector they call them practices, that they can then use to implement those, meet those recommendations. And what we did with the resource guide is make sure that each of those practices had the activities, the tips, a little box on the evidence of why, and then the how-to in them. We developed and tested this really simple assessment tool called the EPAT, Energetic Play Assessment Tool. Like I said, less than 30 seconds for them to benchmark, but also then to continue to review as they implemented the policy. There's a little bit of project officer support, but as I said, it was minimal. I feel like I'm forgetting something. I think that was it. Across those other implementation strategies, but the PD was critical. It was, the part about awareness raising on, why physical activity is important for young children, how much, and then, how to provide more opportunities as well. Yeah.
Thank you so much. I've got a couple of hands up, so I'll hand over to Adam.
Thank you. Thanks, Hayley. A really thorough research project. I'm in northern New South Wales and work in the area of healthy built environments. It was great to see that there was reference to sort of nature play or green spaces. So I'm really keen to know, could you draw any findings or insights into any correlations between the amount of vegetation or access to nature play or outdoor spaces with increased physical activity levels, or behaviours that would lead to that, in terms of designing environments that obviously lead to those behaviours?
Yeah, really good point. I would say not even just our own research. We've already contributed to that space, and what we're planning and got in the works, I suppose, going forward, which is contributing more around longitudinal evidence around parks and vegetation and its contribution to kids' activity and development outcomes. I think the evidence is pretty strong already to say that kids need access to parks, different types of park sizes, and the features or amenities in them is very different for a 2-year-old, a playground, versus a 15-year-old, a skate park. So I think there's enough evidence to say that green spaces and traffic exposure or safety are probably key things in terms of kids' activity in terms of the built environment. Yeah, I mean, there's plenty of guidance out there. I think what we're trying to do is provide more of that longitudinal evidence to say that kids that, for example, grow up and live in a neighbourhood where they've got lots of access to parks, they can get to and from those parks safely. We're also trying to tease apart the parent component, because we know there's lots of research to say you can have lovely environments, but if parents perceive them as unsafe and don't allow their child to go there with them or on their own as they get a bit older, then that's the biggest barrier. So part of that work's also trying to unpack that component of it. Yeah, does that kind of help? It's a bit high level, but I can point you in the direction of more specifics if you want.
Thanks, Hayley. Appreciate it.
Thanks, Adam. Nathan.
Hi, Hayley. Thanks for that. Your presentation is completely overwhelming. I think we're all just sitting here going, holy jolly, this is very intimidating. So thank you.
That data. I'm playing that data.
I'm really, like, your Play Active study, that was obviously COVID interrupted, but we can completely empathise there. But you mentioned that there was some practice behaviours of staff that had changed. Could you give us any insight into what they were and why you think they were the ones that were, like, adaptable?
I have to go back, racking my brain here, Nick, for the details of the paper. So we had in the policy template, like I said, 25 practice areas across. Most of them sit within the educator space, physical environment, families, and then policy review and accreditation. Where we saw changes was in the educator practices. And when we did the earlier national survey, the Delphi work, there's a number of steps in those rounds of surveys of the Delphi where we wanted to understand, get input on what, add all these practices, which ones should be included, where's the evidence base, which should be included in the policy. But where were ones that could have high impact, one, and then two, where would, what did the experts say in terms of those that might be low-hanging fruit and easier to implement. So what we found was there was a smaller subsection of, I think, 12, 15 of educator practices. There's about 7, I think, that we coined, high impact, low effort. And so what we did in the actual implementation process and part of the methods is we encouraged, and because it was only for 3 months, we encouraged directors or services to pick from that set. So you've only got 3 months. There's, all these other, and they're welcome to choose the other ones, but we encourage them to choose from this subset that through the Delphi had identified that there might be, less effort, easier, but actually result in more impact. So what were some of those? Some of them were really basics about just having appropriate clothing or footwear and all that, really easy ones like that. Others were, from memory, was just, awareness raising with parents. So any new parents as they come in to, include the policy or mention the policy to them, make them aware of it. Trying to think, I can't remember if there was one around, I think there was one just simply around providing more outdoor play. So we didn't say, it wasn't necessarily about more time, the practice was about more outdoor play time. Yeah, so I mean, they're all the ones we know are effective, but they were a subset that the Delphi had shown should be easy to begin with and have some positive impact to then help with the motivation to continue to do more, right? Yeah.
Yeah, that's really interesting. And do you think sort of moving forward would you sort of strip it down to those, like if you had to, do this again, would you say, well, let's just focus on those ones that we know they take on and it's easy to do, it might not require so much effort for us and might lead to kind of some change in children's PA?
Maybe, kind of being pragmatic, we know that all those practices are really important. And we know that educator can change their practices and provide more outdoor play, but what if their outdoor play space is cluttered and, there isn't actually kind of a pathway where, kids can scoot around or, a space that's unobstructed. So I think a lot of them are relevant. And again, at a pragmatic level, there was a couple of services that were having some upgrades to the outdoor spaces, so they kind of ticked that as one of their focuses, and that's something. So we're just, yeah, I suppose it's that. Do you want to focus the intervention to, make sure it's more effective in the shorter term, or you want to think at a pragmatic level of being more responsive and, to what's happening, maybe in the sector, but certainly at an individual childcare sector level. I definitely think that going forward that we'll always keep those, 7 as a priority. And we do say in the resource guide, these are the ones that, we encourage and suggest you start at. But have a look at all. And of course, some of the practices they report they're already doing really well. Like, what if they have just had a recent upgrade to their outdoor space and, and that'd be a tick the box, that's already been implemented. We've got a great space. It's now, raising awareness with our educators, training them up a bit more and, actioning some of this. So, yeah.
Thanks, Hayley. We just had another question come up in the chat from RJ, asking whether you had any insights into what strategies might be in place at the services when outdoor spaces can't be regularly accessed, obviously to encourage physical activity. So whether there's, weather challenges, whether that's hot or rainy,
Yeah. Again, that comes out of, I suppose, the original PLAYCE baseline study, and then kind of lots of work with our partner Cancer Council WA in this space. Of course, I didn't mention, but we've modelled what we've done with Play Active on the Cancer Council's Sun Smart program, which is, and for all intentions, depending on where funding opportunities go, it might just be posted right next to their Sun Smart policy because I'm hoping that we can get it even more visible and, and scale it up everywhere except in South Wales. What I suppose has been found there in terms of where that is, there's this mismatch. It's knowledge and awareness, and Cancer Council actually came to us to engage originally because they were going out and auditing or visiting services around Sun Smart policy and practice and noticing a lot of kids were indoors when the UV index was not actually that high. So they've done a lot of education and training on that. So I think sometimes it's, the weather is not that bad, but they're worrying about other things and, education awareness required. Second, we've noticed at PLAYCE baseline, no use of indoor spaces, no opportunities to move furniture and play equipment. So that again is a big kind of practice or strategy that's in the policy and in the resource guide and so forth. So capitalising on those indoor spaces. In terms of weather, there's just so many great programs. There's this Canadian program called Appleseed. You guys do amazing stuff as well. Lots of examples of how you get around some of those barriers, like weather. I don't think it's a good excuse in places like Perth for Mediterranean. So really it's an educator excuse of, The other thing we've done is, and that's through more of our built environment GIS focus, is to look at, do an audit. We're still kind of finishing that up, but do an audit of all the accessible green spaces around childcare centres. So encouraging, obviously following all the safety rules and regs, but looking for those spaces nearby, within safe walking distance that can allow more, open, unobstructed space for running and play, and that energetic play, those opportunities, lots of opportunities throughout the day for the huff and puff. I hope I've answered that question in many different ways, I think. Sorry.
Thank you. Just has anyone got any other questions? We just have a few minutes left, so now's the time. No more hands coming up or questions coming through the chat, so I think you might be off the hook, Hayley, but thank you so much for that awesome presentation and for pulling that all together. That's an amazing amount of work and really crucial work. So really pleased to be able to hear about it. So thank you, and thanks everyone for joining us today. I'll just let you know we have recorded the session, so thanks for that, Hayley, allowing us to do that. So we'll be probably able to post a link to that on our website and share that with people who have attended. So thanks everyone, and yeah, have a great rest of your day.
Thank you. Bye.